Today we're going to be showing you the supplies available to you for urinary catheterization for both feline and canine patients. One thing to keep in mind is going to be the type of test that the doctor has requested to be run. It is important to know what type of sample is necessary: a voided sample, a catheterization sample, or a cystocentesis sample. If a voided sample from your patient is required, it is important to let the patient urinate for 3 to 5 seconds and then collect your sample midstream. If you're going to be doing urinary catheterization, you have many different options depending on what it is that you require. This is a non-indwelling urinary catheter. It's polypropylene. They're a little bit more rigid. They come in these tubes and they come not sterile. So they do have to be packaged up and sterilized before you use them in your patient. It's also important to note what size, so you can get size 3.5 French all the way up to 10 or 12 French, depending on your patient's urethral size. Another option available to you for canine non-indwelling catheters, this is called a red rubber tube, and you'll see here that it is in a sterile package, and it has the catheter size, so the diameter of the catheter, this one is an 8 French, and then it also has the length. The length is important because you need to know that for when you're pre-measuring for your patient, as discussed in other videos, because you want to make sure that the catheter is not too long or too short for the size of your patient. This here is a canine male Foley catheter. This is an indwelling catheter and is used it stays placed in the urethra and the bladder, and it is used with a closed collection system to monitor urine production. This is another canine male Foley catheter. This one's out of the package. You can see it's a larger size, so it would be used for a larger size patient. And it's important to know that with the Foley catheters, because they are indwelling, they have a balloon that you must inflate to keep the catheter in the bladder and the urethra. You would advance the catheter into the bladder until you get urine coming back out of your catheter. You must ensure that you are in the bladder before inflating this balloon. So you'll see here in a minute that I'll blow up this end, we'll have a balloon. Here on this little adapter, it says 5 cc's. So that's the volume that I can put into the balloon that will properly inflate it for this size catheter. You must double check this number. Smaller catheters will have a smaller volume. You may either put air or sterile saline into the balloon. So I have my 5 cc syringe. This adapter here is what would be connected to the closed collection system for urine production monitoring. I'm going to inflate my balloon right here. And that is what sits right at the base of the bladder and keeps the catheter in place. This one here is another type of Foley catheter. So an indwelling male canine Foley catheter is just a different product that can be ordered. It's important to know the different options that you have available to you, and that may change depending on the clinic or the doctor that you work with. This catheter here is also a Foley catheter, but it is a canine female Foley catheter. So you can see the difference. The female canine is much shorter and wider in comparison to the canine male Foley catheter. You can also purchase other brands that will also have a stylet within the inside of the catheter, and it can be removed once the catheter is in the patient, just as technician or doctor preference. And again, this balloon will inflate as we demonstrated here, and it has the little adapter, and it would say it on the other side how much to inflate. You can see other supplies that may be needed. We have sterile gloves, non-sterile gloves, chlorhexidine prep to clean the penis or the vulva. We have sterile syringes. So we have a smaller 5 or 6 ml syringe for our discard urine, and then we have a larger syringe for our actual sample that we will be sending to the lab. We also have an absorbent pee pad to place underneath the patient in case we have any urine dribbling from the collection. Clippers in case we need to clip any excessive fur. Sterile red top tube for our sample that once it is filled with the urine, you will need to put the entire patient name, their complete signalement, the date it was collected, and the time, and then placed into the fridge until it is sent to the lab. We have our requisition form over here. It should also have the patient's file. We have scissors in case you need that, depending on the type of catheter that you are using. Sterile lubricating jelly. If you have a canine female patient, depending on your preference for the procedure, you may require a speculum. So we have that there just in case. And over here we have feline urinary catheters. So this one here is a type of catheter that has a stylet within it that you would use for either a male or a female catheter. It is more typical to see male cats being catheterized because they are at higher risk for urethral obstruction. These ones here are called tomcat catheters. They're very similar but much smaller in diameter to the male canine catheters because they're made from polypropylene. There are two types. There are closed-ended and open-ended catheters. So very important that you know which one you are opening up. And these ones actually do come in a sterile pouch typically. So they do come already sterilized. This one here is a closed-ended catheter. It may be difficult to see, but it has fenestrations on either side near the end of the catheter. So the very tip here is closed, but it has fenestrations here and here. And these ones are used most commonly to relieve urethral obstructions. This tomcat catheter is very similar, but it does not have the fenestrations and the end is open-ended. This catheter would be used to place in a cat for a urine collection sample. This catheter here is known as a slippery Sam tomcat catheter. All these you'll notice are very similar in diameter, so they're about 3.5 French. This one is an indwelling catheter, and you can see here that it has this little extra circle at the top. This will help keep it in place and secure it with some sutures. This one is an indwelling catheter, as it's called a slippery Sam because it's much more pliable and much more comfortable for your patient if they're going to have that urinary catheter in for a day or two.